President John Dramani Mahama bid farewell to Parliament in his final State of the Nation address to the House, telling members he did his best during his tenure in government and gave his all in service to the nation. Though the 1 million votes separating him and the eventual winner Nana Addo Dankwa Akufo-Addo suggest a vote of no confidence in his presidency, he said he would allow history to be the best judge of how he served the nation. President Mahama, whose 4-year tenure expires on the midnight of January 6, however, urged Ghanaians to cheer on the incoming president as he runs his last leg of leadership for the relay.
Political opposition and differences of opinion are vital to the health and growth of any democracy. Political parties are formed when people of similar ideology come together to move their agenda forward in a way that best serves their country's interest. But the well-being of the nation and the will of the people must always come first. Partisanship for its own sake in the end is no better than dictatorship. If we look around the world, we can so clearly see the deep divide that blind partisanship is creating in nations with democracies that are even far older than ours. We can see too the divide that it is threatening to create in ours if we are not careful. Already it's taking a toll on our morale and our sense of optimism. It has given way to a cynicism that is as dangerous to the incoming political party as it is to the outgoing. We cannot afford as a nation to wish or hope for the failure of any president and his or her government. Ensuring accountability is not the same as leveling insults or encouraging apathy. We have history as proof that we have been better and that we have done better, and that we must do better once again. It is my assertion that the information I've provided is a snapshot of the current state of our nation. As I've said before, I'll allow history to be the judge of how I have served my nation. How well I have done my part in running my lap of that relay. What that verdict will ultimately be, I cannot say. I can only say that I have done my best, giving my all, and done so with the best of intentions for my God and my country. Our country, Ghana. This is why I stand here today, Mr. Speaker, holding the baton of leadership, prepared to pass it on with pride, goodwill, and determination to Nana Addo Dankwa Akufo-Addo, and to ask all Ghanaians to cheer him on as he runs his portion of this important relay for Ghana. Mr. Speaker, I thank you, I thank members of this House, and I thank the citizens of Ghana for the opportunity you have given me. May God bless you, and may God continue to bless our beloved homeland, Ghana. I thank you.
He also talked about his achievements, including improving health facilities or health infrastructure and the training of health workers in all the nooks and crannies of the country. He cited the construction of new regional hospitals in Bolga and Accra and said they have dramatically improved healthcare for thousands of people across areas in which they are sited.
In the area of healthcare, the situation was no different. Many Ghanaians were denied access to quality healthcare. Although in 2004, the Kufuor administration had commenced one of the most famous social intervention programs in the health sector on a broader scale, after years of experimentation, the National Health Insurance Scheme utilization was low due to lack of access to health facilities. The sector was characterized by a severe shortage of trained health professionals. Our vision over the period of my administration has been to provide improved health facilities and trained health workers in all nooks and crannies of the country. Construction of new regional hospitals in Bolgatanga, Wa, and Accra is dramatically improving the health outcomes for tens of thousands of people. New district hospitals in districts across the country, including the recent ones for which I just cut short in Weta to cover Somanya, Buipe, Tolong, and Sola, have and will advance even further our policy of providing every district with a first-class health facility. Mr. Speaker, new polyclinics, health centers, and CHIPS compounds have also helped to bring quality health care to the doorsteps of our people. This development has resulted in a phenomenal expansion of utilization of the NHIS. Outpatient utilization for 2015 stood at 29 million, up from 9 million in 2008. Increased numbers of trained professionals being churned out of our training institutions has solved the problem of lack of personnel to man our health facilities. Indeed, at the rate at which this category of personnel are being produced, Ghana may need to sign agreements with less endowed countries to officially deploy some of our health professionals to assist improve their health systems.
And after the address, the president, his shortest State of the Nation address delivery, Joy News sampled the views of some observers, ministers and members of parliament about what the president had to say.
It's very impressive, and I particularly like concise, precise communications that are done by the president. And in this particular instant, he went straight to the point. He discussed his legacy. He discussed the legacy of other presidents, and he concluded by saying it is for Ghana. And this is wonderful. Everything he has done has shown that he was committed to the service of the people, and for which reason we need to be grateful for such a committed citizen of Ghana who ascended to the highest throne or the highest office of the land and shown that he still can love his country and can do things to the best interest of the people. So I'm very happy with the kind of State of the Nation address he has delivered, and I think that other presidents should follow suit. You don't have to have a very long 3-hour sitting State of the Nation. Go straight to the point, mention the salient issues that are of importance to the state, and then let the people judge or look at it and debate it. So this is wonderful, and I appreciate that.
The global macroeconomic situation, the fact that we are under an IMF program which has tied the hands of the government in certain ways, the revenues that were not coming in the way they should, expenditures that had gone up, arrears owed to contractors and to nurses and students and all that. So we all know some of the reasons that things did not go well for the NDC, but President Mahama is a very affable person, very modest and moderate in his behavior, someone who doesn't seek confrontation and conflict. And I think those personal aspects of his played very well in terms of his leadership style, which has allowed the country to go far. But I think what he will be remembered for most are the numerous projects littered all over the country, which today I understand Ghanaians don't necessarily appreciate all those things because they cannot eat hospitals and they cannot eat the stadia and they cannot eat markets. We understand that. So we are all looking at our stomachs only for now. And if people are going to vote based on stomach, fine. They didn't have enough food in their stomachs. And yet, if you go around, you won't find anybody with a so-called rolling chain, for example, which Ghanaians had with exposed what we call collarbones in the 1980s. Most Ghanaians you see, even those who claim to be unemployed, they look very healthy. They come around begging, but they walk away. They don't go crawling. So most Ghanaians have reasonable food to eat. Most Ghanaians have a place to live.
And we hope that everything will work out okay. I think the president's summary of the great jobs he's done in the last 4 years was fantastic. He basically summarized 4 years in 30 minutes, and I think that was very graceful. I wish him well. He's been a fantastic president. He's done a great job, in this country, and I think even though he did his speech in 30 minutes, and which I think is great, we leave it to history to really judge him. I think history will be very kind to him, even though he did not get his second term. But I think he will go down as one of the the great president, especially when it comes to infrastructure. I mean, probably second to Osajifo, Dr. Kwame Nkrumah, as we still fondly, remember him over 50 years later.
Away from Parliament and the State of the Nation address, the Medical and Dental Council has succeeded in partially closing down Obengfo Hospital, with plans to eventually shutting it down after patients of the facility vacated the premises. Well, the administrative manager in charge of investigations at the Medical and Dental Council, Bright Achufuglo, was in the company of a SWAT police team that went to lock up the hospital, noted for body sculpturing, a number of which so far have gone wrong. They, however, encountered some resistance from staff and patients of Dr. Obengfo himself. Well, Favor Nunu accompanied the team and has filed the following report.
Workers at the Obengfo Hospital who protested against the lockdown argued they still had patients who were on treatment at the facility and pleaded not to be forced out. Administrative manager in charge of investigations at the Medical and Dental Council, Bright Achufuglo, went through some difficulty as staff engaged him in wait for an absentee doctor to be present before the lockup. After 3 hours of waiting, the team went ahead to lock up 3 entrances to the facility, leaving one as exit for patients due to end treatment in the next couple of days. Dr. Obengfo, who arrived to witness the lockup, complained that the team had no warrant to lock his facility.
But I find this really, really unfortunate, looking at the circumstances surrounding all this. To think that the medical council will actually come here without a court order, I find that very ridiculous for a professional institution like that, the Medical and Dental Council, to actually go behind and do things just out of the law. I find it so ridiculous and very inhumane, to say the least. Lots of things happen here. To think that they were actually going to forcefully eject patients who are on admission, I find that so worrisome. My clients are so stressed out, and I don't know. I just do not know what else to say, but I find that very, very troubling. Coming from the Medical and Dental Council, I don't know what else you want me to say.
He accused the Medical and Dental Council of foul play.
As at Friday, I sent all my CDPM or my CPD accredited certificates. I sent that to the Medical and Dental Council, and then they rejected them all. Why would they do that? Why will Dr. Atipui, Dr. Eli Kwesi Atipui reject them? Why will he do that when he wants to accept everybody else's? Is he trying to tell me that these CPD programs are not accredited by the Medical and Dental Council? In any case, he has the names. He has my names in their register because they keep track of it.
Have you tried to find out why it was rejected?
Look, you've not my brother. It is so clear. Dr. Eli Kwesi Atipui, okay, together with some doctors, are all behind this. They come again. Behind all these rumors, and they say complications, and they say this and that, and they will not attempt to do what is right and legal to achieve what? I asked them. When you meet them, ask them.
Reporting for Joy News, Favor Nunu, Accra.
And that's it for the news this morning. Just in case you would want to comment on the number of stories you've seen so far, please make sure that you get interactive. 056800,000 is the number for WhatsApp platform. Right now, we're streaming live on our page on Facebook, Join Us on TV. And you can also reach us through portals, and then you can also give us a lot more of your tweets at Join Us on TV. But this session of Parliament, that's the Parliament we have, will dissolve later today. It's supposed to be around midnight to make way for the next session of Parliament. It will be the 7th in the 4th Republic. At least 125 people will be in the chamber for the first time. Some known faces that we all know will also be exiting. Both majority and minority caucuses have named their leaders. But will the current Parliament be remembered for a number of things. What would they be remembered for? And so Mama Bioso Abuaji will be live from Parliament, where she will be interacting with Joe Osewusu. And Joe Wise is a member of Parliament for Bekwai. Theophilus Tetechai is also a member of Parliament for Ablekuma Central. And Dr. Rashid Dramani, an expert in parliamentary affairs who heads the Parliamentary Institute, would also be available for a number of comments. We hope that you'll be joining us within the period. But that'll be it for the news. We're taking a break. When we come back, we'll look at a lot more news stories. We'll look at the newspapers, what stories there are, front, back pages, and look at the center spreads. And then we'll go to our foremost portal, majoonline.com, and go to a number of others, notably CTFM and then the BBC. Do stay on. We'll be right back.